Hi, welcome. Today we have Trisha Cripple with us, and she is a therapist at Shoreside Therapies. Her primary focus is on teens, and I'm really excited to talk with you today, Trisha.
Thanks for having me.
Yeah, so shed a little light on your approach.
My approach is systemic and solution focused. So when I work with individuals or families, I look at the context in which the problem is occurring and how environments or relationships might be affecting the problem. And as a solution-focused therapist, I'm helping clients find their own solutions to the problems rather than just giving advice or trying to solve the problem for them. I also use foundational counseling skills to help clients gain insight or clarify thoughts and feelings. I also bring in cognitive behavior therapy techniques to challenge or restructure unhelpful or inaccurate thoughts, solution-focused therapy techniques to build on what's already working, and Polyvagal Theory, which helps us regulate the nervous system.
I think you said it really nicely, which is helping that client create that solution versus just giving them a bunch of potential solutions, right? Anything else
Right.
with that solution-focused approach that could be useful for somebody to know?
When we are solution focused, we're also building on what already works. We're not trying to reinvent the wheel. We're already looking for what's already working for you and building on those strengths.
Yeah. A lot of times we're not really focused on that on the day-to-day, on what is working well. What are we doing in this particular situation that has worked? Even thinking about a teen in school, maybe they're interrupting a lot, for instance, but when are they not interrupting? Getting some information from the exception. Polyvagal, could you just speak a little bit, maybe give a sentence or two of what that is?
Yeah, polyvagal theory talks about the parts of our nervous system, which is the sympathetic and the parasympathetic nervous system. When our nervous system is dysregulated, we often use terms like depression or anger to describe how we're feeling, but we can go even further with thinking about it as our nervous system states. And our nervous system is in a state of flow every single day, and the problems happen when our nervous system gets stuck. We talk about strategies to get our nervous system back on track and to get that regulated, which helps us feel more regulated emotionally.
And I would think with teens, that would be a huge number one educational point, right? Of how our body works and how we relate to our environments and what we can do to help regulate ourselves. But also with all of the things occurring in adolescence, being able to regulate yourself through difficult emotions could really make a huge difference in somebody's everyday life.
Yes, I would say all the teens that I use this with seem to really connect with this theory, and it resonates with them for sure. One of my strengths is the therapeutic relationship. We know that that's one of the most important parts of therapy is that relationship. And so I spend a lot of time building that relationship. I also am pretty intuitive, so I can easily adapt to whatever the client needs, either in the moment or in that session.
Yeah, those are huge for somebody coming into therapy, especially for teens. It can be very uncomfortable at first for somebody to come in and do therapy, right, for that first time, and making sure that you're focused in on how to build that relationship. We recognize that is that most important thing, and how to do that, right, takes definitely that in the moment intuition and knowing what does this person need? What do they want to focus on? How do I make it more comfortable so they can talk to you? Because that's another thing that, is challenging. And I think for teens, even more so.
Right. And if there's something going on within either the relationship or the session, I do try to address it so that we're not just moving on without taking a look at that, because that can affect the rest of the work that we're doing.
Right. What are they going to expect in that first session Walk me through a little bit of what that looks like.
The first session, if it's a family, I'm meeting with the whole family. If it's a teenager, the teen and their parents or a parent, I start with a family tree. So getting to know who's in the family and those family relationships, because I find that oftentimes when we get to what the problem is, I already know about the family and what's going on there. And so that it doesn't have to be re-explained about how that's affecting the problem. So we spend some time getting to know the family. And then we talk about the problem that's bringing them to see me. And then we do start to talk a little bit about goals for treatment in that first session, what they're hoping to get out of therapy.
So, going through that process of that first session, after that, a lot of people would want to know of like those results of, what can they expect through that therapeutic process. Now, as therapists, we know that we do care about those results, but that it's not necessarily like a checklist of this is what will happen. But what do people tend to say after they've been working with you? What do they notice? What are some responses, feedback that you get?
Well, some of the feedback is that, in particular, clients who are not really sure if therapy can help, maybe they've never done it before and they don't really know how it can help. I've had clients say that therapy was the best decision, and advice they would give other people is, if you're not sure, just give it a try, at least try it out. Clients have told me that they learned how to solve problems. They learned how to solve their problems. It's
Yeah.
not just like, it goes beyond, like, even after therapy is done, you have these skills now going forward to solve things as they come up.
Yeah, that inner confidence, it sounds like, is built, right? And that's something that somebody can take with them for the rest of their life, what those coping skills are, the way that they navigate and solve problems, that mindset of believing that you can solve them. That experience with you gives them that confidence that they're going to be able to handle more than they thought they could. As far as the types of issues you specialize in, are there particular issues, things that you tend to see more in your practice?
I specialize in working with teens that are struggling with anxiety or stress like academic stress or stress having to do with relationships, family relationships, peer relationships, friend relationships, or trauma. I also work with families who are feeling stuck, maybe in a pattern of interaction or communication, and they're looking to feel more connected or to get along better.
As far as tailoring your approach, everybody coming in, completely different person, right? So, how do you navigate that and tailor it towards the individual?
I work collaboratively with clients to identify their goals for treatment, and we put that in a treatment plan and we can use that as a guide for what we work on. I also use the goals to tailor my approach. Depending on what the goals are, I might use a different approach. I also use outcome measures and ask for feedback from clients at the end of each session. And I use that feedback to tailor to adjust my approach. And I'm also intuitive in that I will adjust my approach according to what's going on in the session or what my client might need that day.
It does sound like having that feedback within the session afterwards. I don't think all therapists do that, right? So I think that is a very special, unique thing that you are bringing to the table of like, this is an ongoing process. It's not just me directing, right? It's how are we working together? What can we do to make this experience better and more useful? But are there other ways that you measure that or define that progress?
Yeah, so with that outcome measure, I'm checking in at the beginning of the session too to see how the last week went for the client. And then I keep track of those responses, and clinically significant progress helps us determine based on their scores if there's been progress. But we also look at like progress on goals when we check in on that. Ultimately, feedback from the client, if the client feels like there's been progress, then that's really important feedback.
Yeah. And one of the common things as a therapist is that what we might think is progression might be very different from what the client's perspective is. So having that conversation and communication so helpful for what's working, what's not in the session. And I think especially for teenagers, that would be so useful that they have that their voice in the treatment, in the therapy, in the room. Those situations in therapy where they might be challenging or uncomfortable. So what are some ways that you handle that?
If I'm aware of it in the moment, I will try to name it and address it in the session. I am more of aware of it afterwards, I will likely address it in the next session. And if I'm stuck and I just need a little bit of help, I will consult with other therapists and get other perspectives on whatever happened.
And I'm not sure if that's common knowledge that a lot of therapists that outside consulting is a pillar of being a therapist and working with clients. You in that room, but if something's coming up, getting somebody else's perspective can ultimately shift something or give a
Mhm.
different idea of what could work with a particular client and how people get better and do better and how we as therapists get better. Looking back, there might be a lot of reasons, but for you, what made you decide to become a therapist?
My reason is because I enjoyed working with kids and I wanted to help people. And I actually didn't really even know that this was a career. And so I found that out a little bit later. But once I recognized that this was a career, I knew this is exactly what I wanted to do.
I love that. And the most rewarding thing about being a therapist, what would you say?
The most rewarding thing, I think there's a lot of things that I find rewarding. The therapeutic relationship, those relationships that I get to make with clients who, were really not sure about therapy or whether therapy could help or how it could help, when they say that it was the best decision that they made to do it. And when I see that relationships improve, that is the most rewarding.
Yeah, I love that. Thank you so much today, Trisha. Really nice talking with you. Thanks for staying
You
with
as
me
well. Thank
through
you.
the technical issues. And if you'd like to learn more about Trisha, you can go to our website at shoresightherapies.com. And best way to reach her would be to give her a call. You can also call our main line and set you up with Trisha. So thank you so much again, and we'll see you soon.